Very well, and good afternoon, everyone. One more time, my name is Vadim Gluchenko. I'm director of the Center for Global IT Cooperation. I'll be moderating this session. The session is called Digital Transformation of Russian Healthcare, New Roles, Data-Driven Insights, and the Future of Medicine. This is quite an ambitious title. In a couple of words, let me remind you what our Center for Global Cooperation does. We are the co-organizer of this wonderful 16th Russian IGF, and we aim to increase the level of the Russian expert community involvement in various uh, data and digitalization related initiatives. And we also help our partners and the international markets. And I think we are doing quite a job of this. Russian experts have a lot to share, and we are willing, we are eager to share our knowledge with partners abroad. We have an international session. We have a representative of Serbia as a speaker in this session. However, our IGF that we love dearly has long gone beyond pure internet governance agenda. We talk about everything digital. In particular, we discuss how digital technologies help regular users, in this case, a patient, enhance the quality of their life. Healthcare, health, medicine is something that affects everyone, and there is demand for high-tech and affordable medical solutions. The government is prioritizing this agenda. If you remember, in February at the meeting of the government, the president of Russia instructed the government to implement Russian AI-based solutions in the practice of the healthcare industry. Up to 87% of doctors' appointments in Russia today are booked online. Telemedicine and AI-based solutions are experiencing rapid growth. In 4 years, the number of telemedicine users grew 7.5 times and exceeded 3 million people. Right now, 76 various AI systems are available today in the Russian market for telemedicine purposes. Is this a lot? Is this not enough? This is part of the international trend. In 2025, the number of people using digital healthcare tools around the world reached 1.4 billion people. Basically, every sixth person on Earth has experience of digital healthcare tools. Generative AI and LLMs are the most popular ones. AI is used to analyze data and support clinical decision making. Today, we will continue the dialogue that we opened several forums ago. Let's see where healthcare is moving. In terms of numbers, let me introduce our speakers. We have with us Kirill Arzamasov, um, a doctor of medicine and head of research at the Scientific and Practical Clinical Center for Diagnostics and Telemedicine Technologies of the Moscow City government. Boris Zingerman, CEO of the Association of Developers and Users of Artificial Intelligence in Medicine, National Medical Knowledge Base. Alexei Kushner, head of product development with Antech Lab. Angela Dodorovich from Serbia, founder and CEO of Hata AI. And also Andrei Bovarionkin, Chief Business Development Officer at Top LLC. Let's start with the esteemed colleague from the Scientific and Practical Clinical Center for Diagnostics and Telemedicine of Moscow. You know that the Moscow experiment has become a legend, an icon in its field. This center does an enormous amount of job. Kirill, we often talk about technologies, and we do not talk enough about how technologies change the lives of patients and of doctors. We've got 5 speakers in this session. I'll allow 8 to 9 minutes to each of them to talk so that we have time for Q&A at the end. Right, colleagues, I will do my best to go quickly through the slides, and after that, I will be willing to take your questions. So, the transformation of digital diagnostics and the role of artificial intelligence. Now, this topic is totally not. This is 1971. And in that year, everything that we are going through today have already been theoretically outlined, and the only thing that was missing 50 years ago was hardware. That was the only obstacle to the development of AI. But today we have all kinds of hardware, everything is available, and we are back. To implementing AI in healthcare. So, on the one hand, there is an enormous growth of demand. Of course, we all want to go through diagnostics as quickly as possible to get the results as quickly as possible. On the other hand, the government has to provide the findings as soon as possible. We want the interpretation to be ready within 24 hours. We want all the tests be available. We don't want to wait for all these tests and for all the treatments. We want to be able to make appointments very quickly. Besides, it's easier to buy software than to or the hardware, CT machine or some other piece of equipment than to train a highly skilled doctor. Now, given all of the above, here are some facts from the Moscow experiment. More than 17 million scans have been processed. We are in our 6th year with this experiment. And what's very important is that, on the one hand, precision, diagnostic precision is our highest priority. AI should be as diagnostically accurate as doctors, preferably better. And on the other hand, cost efficiency for the government. It should be cost efficient to implement technology. And here is the economic effect. More than 130 million rubles is the savings that can be achieved through the use of artificial intelligence. In 2024, when we shared these results with President Putin, President instructed us to scale this out to all of Russia. 76 Russian provinces are already connected to MOSMED platform, digital platform, and every month 1 million scans are processed. Can you believe it? 5 different modalities. Now, let's turn to the most important bit. This is how technology is actually used in real clinical settings. Let's take a look at massive scale prophylactic tests like radiology, fluorography of the chest, an X-ray study. First, the patient gets an appointment, then he or she goes to get the scan, then the radiologist would interpret the scan, and the protocol is handed over to the patient. And this is the regular routine. In case of mammography, the process is slightly longer. One radiologist is not enough. We want to be as sensitive as we can. We don't want to miss out on any cases of potential breast cancer. So we need 2 doctors involved. The first doctor interprets the scan, then the second doctor interprets the scan, and then we get 2 opinions. And then, it depends on whether the doctors agree or they disagree, etc. Then the patient would be routed to additional studies and tests if necessary. And we are implementing AI into these routes. There is a certain transformation happening to the process, to the procedure. In case of mammography, the first reading is replaced by eyes. So the saving is immediate. We don't need to pay one more doctor for this study, for the visualization study. But it doesn't mean that we are not getting rid of the doctor. No, we have shortage of doctors, and that's why we need to have more AI in the process. Okay, maybe in Moscow we have more doctors, but in the Moscow region, for instance, you can have just one radiologist per whole of the hospital. Where do you find a second one? Well, AI can step in for that missing doctor, for that vacancy. So as soon as there is a scan, the AI kicks in and goes through its algorithm will be able to get not just the textual description, but also the visualization, the graphic description. And the doctors will investigate that particular area, and the final decision will be with the human doctor. And as to large-scale prophylactic studies, like X-ray of the chest, for instance, not very many people get diagnosed with an X-ray, maybe less than 1%. In all other cases, the doctors will just put a rubber stamp on the document saying normal, normal, normal. Here, AI is very important. AI can split the flows, so to say. When it's normal, then the radiologist doesn't need to spend time on describing the case. If there is some station, the station, immediate patient is channeled based. And the sensitivity is up to 100%, 99.95%. This is better than any doxa. That's a feature of the AI algorithm, which can be fine-tuned to such an extreme. You can read more about that in a paper that we published based on the review of the first 5 years of the experiment. We are describing all our testing techniques, all the hypotheses that we checked in all these studies. Now, as a next step, we are moving forward. We gained experience ourselves. We are now ready to share it. And these are the manuals. These are textbooks on how to employ AI in the doctor's routine. And this is the next step. These are the papers that we use in education. Now, generative AI, all the hype. Now, in the 1930s, the idea was that the doctors don't have enough time. Doctors don't have time to study all of the illness history. But you know that even today, we have all the tools, we have complete medical records, and there is never enough time for doctors to study all of medical record of a patient. And AI can help. Obviously, there are some companies that implement or try to implement AI. They are trying to sell more service, more video cards, and there are people who are saying, okay, we don't need doctors anymore. Let's replace everyone with AI algorithms. But we are people of academia. We are rational people. Let's take a more rational approach to that. Our center today is developing scientific approach to the usage of generative AI. Now, what the models are capable of, diagnostic accuracy is 0.71, which is very little. It's too little. It's not enough. It's worse than what a radiologist can demonstrate, or even computer vision, because in the experiment we have many more different indicators. What else is important? Now, we need to understand what the algorithms are in medical records, for instance, in the medical history. Can you ask Google to describe you the medical record, to summarize it? Well, of course, you can ask them. What kind of answer are you going to get? Now, this is where it gets complicated. On the one hand, you will be able to perhaps get a summary, but for instance, the reader may be impressed, but then the algorithm may decide to add something on their own, and here the doctor suspected cancer. Well, in fact, the records themselves say nothing about cancer, or say nothing about suspicions of the doctor, of the physician. So we know that models can hallucinate. We need to monitor for hallucinations. We need to test the algorithms, and also the culture of generative AI applications. It's time to shape it. We should be thinking people when we apply generative AI. We can't let natural intelligence degrade that much. We need to exercise academic, scientific approach to the testing methodology, et cetera, and only then AI will become a powerful tool in our hands. Thank you very much for your attention. Kirill, thank you. That was very insightful, actually. And in the morning, we also talked about AI implementation in government, at the level of a society, and often people, the panelists here, sounded quite pessimistic. Not everyone believes that AI is a beneficial tool. However, healthcare is a rather sensitive area. It touches all of us. Judging by your talk, I think that the glass is half full rather than half empty, and AI in healthcare can play a role. Of course, it's not going to replace a physician, but it can play an important role there. Colleagues, have you ever used telemedicine? Anyone? No? Very few people. Telemedicine, okay, let me explain myself. What I mean to say is actually you don't go to see a doctor in a hospital, but you talk to a doctor remotely. You are being advised remotely. Some time ago, I lived in Western Europe and I used telemedicine with Russian doctors quite actively because European healthcare is a thing in itself. I'm not going to criticize it, but to make an appointment with a specialist is next to impossible. I mean, you have to stand in lines and queues for months. So I used telemedicine when that was not mainstream yet. Now, let's turn to our next speaker. We understand now that AI often acts as the second and sometimes the third opinion. And the most important role of AI is to be a reliable assistant of a doctor, an assistant that assumes all the routine jobs. Andrei, please tell us, how is this done in your product? And how can we make sure that doctors trust the machine and yet be the main decision maker in the process? Well, thank you very much. And yeah, we do a lot of work. It's a pleasure to be here on the birthday of RUNET. Russian internet is rich in various innovative practices. We see considerable development of various services and platforms. We are all users of a lot of platforms, media platforms. Almost everything today is available online. Banks are major locomotives of these best practices. Audience today is not medicine related, but still, I want to talk to you about healthcare and about approaches that today are considered to be best practices in Russia and abroad like to thank the Center for Global IT Cooperation and the Digital Attaché service that they have. Together with them, we promote Russian healthcare solutions abroad. And these approaches are something that I would like to share today. Our customers, both here and in other countries, want to get solutions on a turnkey basis. And the third opinion, третье мнение, is the developer of AI solutions in healthcare. Today, these solutions are considered to be medical devices and they are subject to monitoring by regulators, Roszdravnadzor and the Ministry of Healthcare and other government authorities. And this service is, well, this artificial intelligence is an imitation of natural intelligence and in case this device has certain parameters, it meets a certain specification and it performs a certain task. It's not just any chatbot, it's an expert system. And these expert systems are not generative, mostly they're discriminative, normal, or pathology. They're used in operational surgery screening and other scenarios where information is provided to humans in the decision-making process in order to accelerate that process. We have already mentioned the difference between humans and software. Well, actually, we need to get away from this kind of comparisons. Everything depends on scenarios. It depends on the tasks. Both here and abroad, there are scenarios where AI can prioritize patients and split the patients into cohorts. Does this replace a doctor? No, but it saves doctors time. And again, if patients are considered to be within the normal range, then this can save time of a doctor. Here you can see the findings from Russian and international studies. Up to 40% of time can be saved through prioritization within normal range, outside of normal range. Today, some European studies involving hundreds of thousands of patients claim to get even high, even better results, given proper scenarios, given proper training. At least 30% of resources can be saved with AI. We just have to remember that the objective of the government well, the objective of the government is government level, while doctors have their personal objectives. So we need to find areas where these interests coincide or match. Otherwise, these services will be to the benefit of just one stakeholder, while the other stakeholder may be neglected. So when you are developing these solutions, you have to bear this in mind. Today, there is a transfer between individual or from individual solutions, standalone solutions to solutions on a turnkey basis. It started with Talks' AI assistant, retrospective analysis, risk cohort distribution, quality control, today, the biggest studies in Russia, well, obviously Moscow is in the lead. Probably they have the greatest number of such studies. Then there are national centers that assess the effect of AI in their practice. In the past, we talked about technology and its capabilities because it was something new, but now effects are becoming more important, and you can see the effects from AI at the scale of a country much better, much clearer than at the level of a particular hospital. Now, reasons of death, causes of mortality, like cardiovascular diseases, cancer, etc. In case of the breast cancer scenario, indicators, according to the National Center of Therapy and Prophylactic Medicine, there is a study that they conducted that shows that those regions that implement AI on a bigger basis, on a larger basis, are able to improve the detectability of oncology of cancer almost 2 times better. And obviously, when cancer is detected at early stages, the survival rate is higher. It's up to 90%. So you can also improve the survival rate. You can add years of life to the life of these patients. For AI to be efficient, proper scenarios must be involved, infrastructure must be supportive. These tests, I mean, if the doctor gets the findings too late, whatever AI, whatever equipment you have, there will be no effect, only the effect will be negative for the doctor. So it's not about the qualities of the technology. We know that technology is capable of identifying pathology in a scan and control for the quality of test and detect early signs of oncology. The important thing is how all of this information is integrated into routine flows. We are turning from paper to digital records, digital logs, and it means it's not enough, both for the patient and for the doctor. The routing should change, scenarios should change, routine, the flow, the procedures should change. And one of such changes is, for instance, approach to analyzing different types of data. For many years, we have been observing how different platforms are handling different types of data quite successfully. There is video analysis, the data from cameras in the inpatient units. There is medical records, there are scans, and for one patient, you can analyze a combination of different data. And you can also remove some signs, for instance, from the analysis, like the medical record says that it indicates at one possible diagnosis, the scans indicate a different possible diagnosis. So in combination, you should read the data in artificial intelligence in The connection to is poor, and the translator is not getting all of the sound. So you have to set these tasks to the developers, to the coders, and then you'll be able to measure the performance, the efficiency in clinical terms, organizational terms, and economic terms. On the part of the platform, we opened our platform free of charge to 16 universities. They are already connected to the online portal that doctors can use to study, to share their cases, to study the scans. And this platform is also available in 8 countries with the support of our allies in the Eurasian Economic Union. We want the doctors to understand that AI is not a magic button or it's not a magic pill. It's a technology. It has a certain script, a certain scenario. It is enveloped in a certain shell, and it can't replace the doctor, but it can help a doctor in particular by saving doctors time. This is platform approach, and just like everywhere else, it saves resources. All the solutions are presented at a one-stop shop. Different data can be analyzed in combination with each other, and it can provide additional services to the doctors like FAQs or advising the doctor on how to best employ this technology. A neural network that is not serviced, that's not maintained in a hospital, will not be efficient. Today, a neural network must be embedded into a real doctor's procedure. And getting closer to the topic of today, in reality, AI is a matter of digital sovereignty of a country. It's a matter of protecting the interests of the country. So, should we start getting a lot of international solutions, it means that these solutions will have to get access to the Russian data, and this involves risks and ethical problems that require solving. So together we must build digital sovereignty. All solutions that we use today that have access to the data, they are all domestic solutions. And it's a major achievement. So the country, the developers, the regulators, it's to their merit. Russian healthcare uses Russian-made solutions. In conclusion, a lot of different tasks can be solved. Obviously, doctors have their own approach to artificial intelligence. Like some are quite wary; they think that AI has come to replace them. Well, in reality, it's quite different. Our doctors, the doctors themselves, and the regulators, they are the ones that set the scenarios, that decide on how AI will be involved in that process. And they determine the development path of AI. AI is not good, it's not bad, it's the way we make it together with the doctors. So I think that AI has a place and a role to play as a platform, as a service. We will witness its development in the near future. And the important thing is to get the skills of working with AI at this point. Thank you. Andrzej, thank you very much. And a special thank you for referring to digital sovereignty. This is the topic that opens this forum. We have here colleagues from the Office of the President, the Ministry of Digital Development, and Russian Parliament, and they all confirmed that Russia is one of the few countries that has true digital sovereignty. We have our own open service, cloud services, our own national messenger. We have our own search engine, etc., hosting providers, etc. So we also have our own healthcare solutions. They are 100% Russian made. I think that this is perhaps even more important than all of the above. Now, moving on, colleagues, let's talk about data now, since this is part of our session today. Probably many of you have heard about asynchronous healthcare. First, the patient passes the tests, lab tests in particular, wears, I don't know, fitness bracelets and smartwatches, and then gets all the findings on the screen of the smartphone. For all the data to be accurate and in proper compilation, not to leak, there should be cooperation between various stakeholders. So, Boris, a question to you. How do we envisage the system of data turnover to make it safe and reliable? Yes, colleagues. Andre and I, on Friday, we attended a big telemedicine forum in Skolkovo. I was getting ready for it. I lifted my eyes from the computer screen, and I see on my wall a piece of paper. I received this paper from academician Savchenko, director of our institute, back in 2013. It was a letter of reprimand. He reprimanded me for constant non-compliance with my duties and exceeding my powers. What happened in reality is, for the first time in 2013, we sent the lab tests findings to one of our patients by email. And this is what caused this diatribe from my boss, my superior. Should we share the data with the patients? I remember attending conferences that discussed topics like that. Should we share data with the patient? No, the situation is quite the opposite. If you look at two key federal laws that govern circulation of medical data, both laws say that any data exchange happens with the consent of the patient. It's not clear always how the patient may consent to the exchange of data and how. So today we get to face quite a challenge. It all started when big labs boomed. You know that we've got lab networks, and these lab networks they send the lab test results to their customers by any means available, email, phone, anything. And today, all medical institutions in the country, the way the system is structured, are supposed to register all medical records in the register of medical records of the country. Okay, so you can register your papers there, but to retrieve the papers from that archive is next to impossible because the patient needs to consent for that. But I don't know, for instance, you went for an examination at the national center, and that center logged your data with the national register. But then you go back to your place of residence, and you go to your local hospitals. The local hospital doesn't have access to the national systems. It's without the consent of patients. You can't share them directly. And unfortunately, it is quite a challenge. We need to find a tool um, that the patients can use to collect the data from different sources. Well, there's this register, then called user accounts for the patients, their webs, you know, user account. And the user you can find whatever. And action is unstable and the wording from the speaker, the translator correct. Often are quite heavy. You need to upload the cloud onto cloud. So it's still inconvenient to help patients data. Survive national healthcare platform The project has an ambitious goal. Patients who have chronic non-infectious diseases must be remotely monitored using digital services. Is the goal. We all have smartphones. We use smartphones to call in taxis, to order food. So the idea is that in several years' time, chronic patients, should be constantly in touch with their doctors using their phones, using a special app. We're still not clear how this is going to be realized, but document exchange, data exchange should be part of that system one way or another. And different gadgets, as I don't know, smart phones, smartwatches, or glucose monitoring devices that are operational 24/7. There are today so many different devices that patients can use at home. We are developing today a system of remote monitoring that will enable the patients to communicate with their treating physicians to um, uh, deal with their illnesses in a remote fashion. I think that this is a humane application of the internet. Internet enables people to talk to their doctors and discuss matters related to their health. We already have some solutions as part of this package. In the city of Orenburg, for instance, all pregnant women, when they register with their obstetrician, they can connect to a special platform from the office of that obstetrician. They can become users of this platform, and then later they can get in touch with the obstetrician, with a gynecologist, remotely. When we were implementing that system in Arenburg suffered a flood, a catastrophic flood. And the system proved to be indispensable in helping women, pregnant women, during an emergency. And the doctors gave the name to the whole system. We are nearby. They call it nearby. It's a way for doctors to be nearby, to be near their patients at any time. Another interesting tool that's part of the package is we have a project together with the Central Institute of Traumatology. When patients get ready for a surgery, they receive instructions as to what they need to do, what kind of tests they need to pass before they get operated on. And the doctors can track the progress of the patients online. And by using this simple tool, the center managed to bring down the number of refusals to hospitalize the patient sevenfold. It is a simple tracking system. Another thing, when patients get access to a lot of data about themselves, well, first of all, patients start reading that data, they start using that data, and they not always understand what's written there. I mean, the diagnosis, yeah. And they also want to be informed in a situation when it's not very easy to get through to a doctor. It's much easier to get through to an LLM. You know, people upload all their data into the LLM, into some chat, and they start diagnosing themselves, and they start adjusting their treatment, and they start refusing the therapy prescribed by the doctor, especially if they can't ask the doctor directly whether what they plan to do is actually allowed. And it's a major issue. Colleagues today have already said that it's important to have the skills of using AI in the healthcare setting. In the last 5 years, I keep asking the same question over and over again. Will AI replace a doctor? Well, I heard someone say that AI will never replace doctors, but doctors who use AI will replace those doctors who are not using AI. I like this kind of formula very much. Well, in this formula, we forget about the patient. There are patients who can't get through to doctors. The patients will vote themselves to remove the doctor from the process altogether, which is bad. But it also means that our solution should become more patient-centric. They were facing a big problem, as colleagues have mentioned. The system of AI for doctors should be registered as a medical device. Today, this registration follows the topmost class 3. All medical devices are assessed on the risk, depending on the level of risk. They have to follow this or that procedure, like a computer tomography machine. Well, AI is the highest risk class possible. It means that to register an AI-based system is long and expensive. But that's for doctors. But AI for patients is not supposed to go through any registration, and maybe uh, developing solutions for patients outside of the healthcare institutions. Developing solutions for patients may become a more efficient pathway for companies and startups. Thank you. Boris, thank you very much. Such a profound understanding of the topic. And the cases that you shared, they are quite impressive. The reduction in the number of refusals to hospitalize and the initiative of doctors in Orenburg. This is great. Yes, it's very important for patients to understand that doctors are close. They can be easily reached. With AI, without AI, and obviously doctors who have the skills of AI, the future belongs to them. We know, and I'm sure we all know Interclub as one of the Interclub as one of the leaders in intelligence, but today they're also leaders in healthcare. So, Alexei, what restrains the implementation of healthcare technologies? Is this the conservatism of doctors or insufficient sufficient funding, or what is it? And also, since your company uh, uh, acts dynamically in international markets, Russian AI-based healthcare solutions, are they in demand anywhere outside of the country? And I mean in particular the global south. Good afternoon, colleagues, and congratulations on RUNET birthday. I agree with colleagues. AI is developing dynamically. I would like to support uh, one of the speakers here is that patients themselves and also healthy people have direct access to free artificial intelligence. GigaChat, Lisa, Alice by Yandex, or other sovereign platforms, which is good news for the patients because doctors would like to be able to talk to a patient who is realistic, who is knowledgeable, who is aware. And it's wonderful that, again, patients have access to those free resources. Now, to answer your question, what is the biggest restraint? Is this knowledge? Is this infrastructure? I think that knowledge of risk factors and prevention and developing the skills and habits. When people communicate with AI, people tend to be keen to become more aware of the risk factors. I think this is quite useful for the doctors. And when Simashko was building the three-tier healthcare system in the Soviet Union, back in last century. And given the shortage of resources, the retreats and the resorts in the south of Russia proved to be very beneficial because they helped save health, they helped prevent diseases. So artificial intelligence is somewhat in certain respects, is this resort of the South because AI doesn't provide medical care. It doesn't treat. it doesn't cure, but it provides information and it involves patients into maintaining a healthy lifestyle. So I suggest that everyone uses open sources, but not for self-treatment or self-diagnosis, but rather for prevention, for the purposes of shaping your habits of a healthier lifestyle. And then the doctors will be absolutely happy if people take care of themselves, they get enough sleep, they prevent stress and improve productivity of labor, and then healthcare will allocate all of its resources and lab diagnostics, instrumental diagnostics, rehabilitation, everything, surgery, whatever. So AI can be of great assistance in this respect. I remind you that on our planet we've got about 400 million patients and 7.4 billion people who are considered to be healthy, and healthcare can only deal with these people when they begin to complain and come to see a doctor. So again, AI can really complement the healthcare system resources, fix the shortage of doctors, because healthcare has limited budgets everywhere, and this budget must be allocated in a targeted manner with full controls of the spending, and AI again can be a great help in this task. Speaking about the competitiveness of Russian AI-based healthcare solutions, well, in friendly countries, in our partner countries, Russian solutions are already in use. Intelligence, for instance, several dozen countries are already covered with our solutions. There are also pilot projects going on in several other countries. There is certain unevenness here, speaking about the Russian viewer in Navitech. It's operational in dozens of countries in radiology. AI for interpretation of radiology information. We only have pilot projects, and we have successful implementations in a couple of countries rather than dozens of countries. But you see, because not all of our services can be shared free of charge. Some of them are can be shared on a paid or fee basis. There is demand, there is request for platform solutions, um, especially in training of healthcare specialists. When we use our platforms to educate, to train international doctors, when they, advance in their careers, probably when they leave to become managers of healthcare, they will promote Russian solutions. You know that those doctors who were trained in the Soviet Union, they still think very highly of the Soviet system of education, of Soviet healthcare, and they are good friends of the Russian providers as well. So I think the same cycle can be repeated. Those doctors who will be trained on the basis of Russian AI will be supportive of further Russian-made products in the future. And uh, AI is a tool to, um, it's a tool for the future. What I mean to say really is we are dealing with a lot of data, right? We are overwhelmed with the data. And yet there are other types of data that we are not yet accumulating, we are not yet collecting or analyzing, like circadian rhythms, for instance. Google in 2012 closed its Google Health project, not because they didn't have data on pathologists, they didn't have data on healthy humans, they didn't have the data on normal ranges, reference intervals, we still don't have enough data on what is healthy. What is a healthy human being? So we need to accumulate about 1 terabyte of data about healthy humans, but where do we get them? Do we have the gadgets? Do we have the measurements? Or what is measuring circadian rhythms, for instance? We have a lot of data. We have access to complaints and medical records, but we don't have enough data on healthy humans. And probably I will not be uh, enough to deal with such a tremendous task. The Moscow experiment is helping AI to develop quickly and successfully, but you know that what else is developing? It's the data storage systems and telecom channels and monitoring and quality control and indicators control. It's a whole infrastructure. So we need to we have to develop not just artificial intelligence, but all other links of this collecting the data, storing the data, interpreting the data. The whole infrastructure requires colossal investment and development to grow super large, exponentially growing data sets. Thank you. Alexei, thank you very much. Indeed, it was a very detailed and comprehensive answer to all my questions. And you also shared your insights, ideas as to what's missing. And what's missing is the data on healthy humans. I've never thought about it myself. We need to have a benchmark, indeed. Now, colleagues, we are ready to turn the floor to our colleague. Angela, are you there? Yep. Hello. Oh, great. Angela, thank you very much for being with us today. Thank you for connecting to this session from the other side of Europe. From your point of view, as an entrepreneur in the field of AI, is it difficult in Europe? And we know that in Europe, regulation is rather severe, especially in case of digital data and artificial intelligence. So is it difficult to build your own business in Europe today in healthcare, in AI-based healthcare? And if you don't understand English very well, I'm talking now to the audience, you can connect to our broadcast over Zoom. We'll be translating there. Thank you very much for this invitation. It will be easier for me to speak in English, but you can ask your questions in Russian and we'll be happy to answer them.
Forgot to mention that we operate like mainly in France. Our offices are in Paris, but we cooperate with companies in Europe and in the US. So it really depends. I'm very familiar with EU regulations, and it was really useful to participate in this session to hear the experiences from all of the colleagues about how it is in Russia, how the guidelines are being made, and we can discuss that a little bit later. So if you can go to the next slide, I just wanted to start talking about some of the systems that we have developed. So we help build medical device AI systems. And basically, the idea is to build systems that are both trustworthy and compliant with national laws, but also with EU AI Act. This means that some of our clients face typical barriers. They have legal uncertainty about AI-related liability. They have limited access to high-quality medical data. And sometimes they have a resistance from doctors, from clinicians who see AI as a black box, rightly so, rather than a transparent decision support tool. So when we talk about European Union, AI in healthcare mainly falls under the EU AI Act. And also we have specific regulations. We have a medical devices regulation, and we have in vitro diagnostics regulation for the medical device companies. Now, it really depends on the type of product that you're building. A couple of participants have mentioned the generative AI and the chatbots, and I feel like this is more so accepted. While like when you develop clinical AI systems such as diagnostic imaging or risk prediction tools, this is really treated as a high-risk solution. Sometimes these are treated even as a medical device. This really triggers obligations on different areas such as risk management systems, such as data governance and quality, and so on and so forth. So once that we classify a solution as, say, a high-risk solution, so it's not a chatbot, it's more kind of a medical device system that we'll use, I don't know, like for clinical application to either do some automatic prediction over imaging or predict or classify a potential disease or so on and so forth. We must satisfy requirements that are on top of the specific rules that all of the devices that we use for imaging require. Some of these include risk management systems. This is basically a built-in continuous AI-specific risk management process, like that's covering misuse, biases in the data, drifts, and performance degradation across the life cycle of the product. Another one is the data governance and quality. This means that the training, validation, and testing data must be really relevant, representative, and robust, with measures to really like detect and mitigate all of the biases, all of the errors that we have in data that are linked to sensitive characteristics. We all know that medicine is a very sensitive area, and it's impossible to really like be in accordance with regulations if you don't know them really well. So we do need human oversight and use monitoring. This really means that the device must be designed so that qualified humans, whether it's practitioners or doctors or whoever else is working with this device, can effectively supervise the entire functioning of the device. This means either overriding suggestions or checking inputs and outputs. It can happen that, of course, that the system makes mistakes, but paradoxically, it can happen sometimes that the system would give a solution that the doctor wouldn't, or really can see something in the data that we would normally miss. So I think to conclude, like the most important is actually to cooperate with all of these machines effectively, to do everything that we can from the technical side, of course, to be in accordance with the regulations, but first and foremost to really think of who we're designing the devices for and the software solutions for, and this is the patients. And if you think about like the patient's needs first, and if you think about really healthcare as a very wholesome area, if you think about saving their lives, I think it gives you some sort of motivation to do everything in accordance to what are the guidelines that are already established. If we can go to the next slide now. Overall, this is a very interesting study published by Anthropic recently, like one of the leading LLM providers, that actually explores how much or how little AI can potentially change within different areas. And this is on this graph like in blue, and then how much of it has been done in red. And if you look at the healthcare, you can really see that there are a lot of potential areas. It's just at the bottom of a graph for healthcare support, but also for healthcare practitioners, where they can more and more use some of these available tools. However, unfortunately, I don't think there is enough of use, because like we're just being bombarded by a bunch lots of regulations, both for startups and for the large companies. If we can go to the next slide, I will just conclude that as we can see, healthcare market is increasing at a very rapid rate. As a matter of fact, its compound annual growth rate is around 35%, and it's expected to reach $1 trillion globally, which really means that obviously companies are interested in investing in AI, and beyond this, really like AI in healthcare is an area that is expanding. And I think having forums like this discussing really with professionals that hands-on work on problems like this is mega important. And I think beyond barriers, collaborating across countries, regardless of the geopolitical situation, of course, collaborating across EU, Russia, China, US markets is crucial in order for the health market to keep on expanding and in order for us to improve the graph that I've put on the previous slide, where we more and more rely on technology and really use technology to save lives and just for our general well-being and improving healthcare.
Angela, спасибо огромное, особенно
Angela, thank you so much for the final message that you drove home. Indeed, there is much room for improvement as far as collaboration is concerned, and we do need to cooperate because healthcare and medicine in general are, well, this is the third time I've been repeating that, are close to heart to everyone. And these are noble domains, noble industries, I mean, healthcare industry, and we need to stay friends. And the facts and figures that you shared with us in the very last slide are very impressive. Indeed, the healthcare market will triple in the next 6 years. That just goes to show you. Ladies and gentlemen, to sum up, I just wanted to share with you an insight. When we planned the session, the working name was we're gonna hear you as well. We decided against naming the session in a joking way, but you know, the idea was as follows. Using digital technologies and AI in healthcare and in medicine in general is not just a trend. This is something that we cannot do without. It's inevitable. Once again, I'd like to thank our panelists for their confidence and for their trust that they instilled in everyone. And in particular, I'd like to touch upon the fact that a healthcare professional proficient in artificial intelligence is like a god. Thank you so much.